Well, Dr. Sasan, I think we can go ahead and get started. So my name is Audrey Kresmer. I'm part of the Kindbody team here, and so thrilled to have you all with us this morning. We are going to be led on our Fertility 101 by Dr. Fahimeh Sasan, who I'll introduce in just a second. But again, thank you for your time. We know it's just before a holiday weekend, and I hope you all have some fun plans coming up for the 4th of July. But really appreciate you taking the time this morning. We're excited to tell you a little bit more about Kindbody, but also just provide that educational support with respect to fertility, how fertility works, what options are out there for me, and also talk about the amazing benefits that your company has provided to you. And so with that, I'll go ahead and turn it over to a couple of my team members that I'd like to introduce. But Dr. Fahimeh Sasan, would you like to introduce yourself?
Hi, I'm Dr. Fahimeh Sasan. I'm a board-certified OBGYN and the founding physician of Kindbody. It's a pleasure to be here with all of you today. And again, I reiterate what Audrey said, and thank you for joining us. I know these are really unprecedented times. 2020 has certainly turned out to be very different than any of us had expected. The focus of today's talk is to give some foundation on fertility, cover some topics that a lot of us unfortunately don't know very much about, and then just to further explore just fertility options and what they may mean for different individuals. Really happy to be here with you guys.
Thank you, Dr. Sasan. And then Kindbody Tracy, would you like to say hello to the group?
Hi, everyone. Welcome. Again, we're always happy to do these amazing events to provide education and support you in any way that we can. So thank you so much for joining us today.
And so with that, I'll go ahead and kick us off, and then I'm going to turn the reins over to Dr. Fahimeh Sasan to lead the majority of this session. But wanted to introduce you. If you haven't met us before, well, it's a pleasure to meet you all, and we are Kindbody. And so Kindbody is on a mission to really make women's health and fertility care more modern, more welcoming, and more accessible for all. And so what we're here to do today is just have a very informal but comfortable and empowering conversation with respect to fertility, how fertility works, what options are available to you. And with that, you're all with us today because your company has provided Kindbody as a benefits package to you, which is an incredible benefit. A lot of different patients and individuals are coming to us constantly asking if their company can provide fertility benefits for them. And so your company has added Kindbody as a benefits package, providing you discounted rates and different coverage specific to your company and specific to you, so that you can access a full suite of services. You have access to fertility, you have access to mental health, nutrition, gynecology, you name it, Kindbody is going to provide it for you. And your company felt it was so important to be able to provide you access, to empower you, and to be able to provide that level of accessibility so that everyone can take advantage of not only learning about what's happening with their body, but potentially build the family of their dreams, dependent on what their goals are and what you're looking to get from it. So my name's Audrey Kresmer. I'm in here as Kindbody Audrey. Understanding that we have a lot of different people joining from different companies, if you have any questions throughout specific to your benefits coverage, feel free to message me directly and I can help you with your specific coverage and be able to better address your specific questions on your benefits package. Otherwise, we'd love to have you in the chat. Feel free to ask as many questions. I've got Kindbody Tracy here to assist. And then India is going to be in the chat as well under to assist with some of the clinical questions as well. And as Dr. Sasan goes along, we'll be sure to pause and address any questions that you may have. But before we get started, we would love to know where everybody's joining us from. So in the chat, feel free to just shoot over a note. Where are you joining us from? I'm here in New York City, right in Manhattan as well. I believe Dr. Fahimeh Sasan is. So Dr. Fahimeh Sasan, where are you joining us from this morning?
Yeah, I'm joining us from our New York flagship location, which is on 102 Fifth Avenue, so right near Union Square on 16th and 5th. We have been open throughout this pandemic, and if you are in the New York area, we would love to see you here. And hand it off to Tracy, who's in a beautiful garden. I wish I was there.
I'm coming from San Diego, California. It is a little overcast, but I can fool you with all my greens and good stuff. But yes, we're all together. Together, we're all together from coast to coast.
And it does look like we have quite a few people joining in from New York City. So with that, Dr. Fahimeh Sasan, I will go ahead and turn it over to you to walk everybody through.
Wonderful. Well, thank you, Audrey. So at Kindbody, as Audrey just mentioned, one of our main missions is wanting to really end the fragmentation that currently exists in the healthcare system. And what I mean by that fragmentation is that as a woman who maybe needs to just get a checkup, you often get siloed to very different places in order to get what you need done. So maybe you needed to have a pap smear, you go to one doctor, the doctor thinks you need an ultrasound, they refer you to a radiology center to have an ultrasound, and then if you do end up needing any fertility care, egg freezing, or any kind of fertility treatments, you may be referred then to a different doctor or specialist to address those needs. And so our goal at Kindbody is to bring all of that under the same roof and to recognize that all of these things should organically live together. And so we provide the entire spectrum of fertility care, gynecologic care, and then the counseling and support, which is such a crucial part of this whole journey, all in the same platform, so that one, we can be respectful of your time, and two, so that we can take away some of the added stress that can be involved as one is going through a fertility journey. So whether you just need a pap smear, you're interested in learning more about your body, or you actually need fertility care, and again, whether you are in a relationship or you are in LGBTQ, you are single, you want to have a family on your own, wherever you are in that spectrum, we're here to help you address your needs from A to Z. All right, and so some of the things that we just want to stress is, I know everywhere everything is different than what we remember it, but our clinics are open. So as I mentioned, I'm here in New York, but our clinic in San Francisco is open, our clinic in Santa Monica is open. We'll actually be opening our office in Princeton, New Jersey in the early fall, and in Century City in Los Angeles also in the early fall. And so we are here, we're open, and I really do stress for everyone, regardless of where you are on your journey, to know that time is so important when it comes to fertility, and to not put off our wellness. So maybe you're overdue for your general checkup, or you've had an ache or a pain you've been ignoring, or the bottom line is you were interested in pregnancy but just have been kind of putting everything on hold, as we all have been because of the COVID crisis, to really recognize that now time is of the essence, and we're here to help you, whether it's virtually or in person. Really take care of yourself, and we're open. All right, so the focus of the rest of this talk will be really just kind of walking us through Fertility 101. And the reason why I think that's really important is that regardless of how educated you are and how high level you may be in your career, fertility is something that we all know very little about. I would even argue that a lot of doctors, unless they're actually OBGYNs, know very little about fertility. And the truth of the matter is when would we have learned it, right? We kind of spend our entire lives, I think as men and women, trying not to get pregnant or trying not to get someone pregnant. And so when it finally comes time to wanting to achieve a pregnancy or wanting to have a family, it's pretty commonplace where people are like, wait a minute, okay, where do I start now? What am I supposed to do? And so the key is empowering yourself with knowledge, empowering yourself with options, and then just knowing, okay, what's my first step? And so that's my goal today, is to give you your first step and hopefully empower you with some information that you can then use to make the best decision for you. All right. When it comes to fertility, I can't stress this enough, the most important thing to know about is age. And the reason for that is, as women were born, you can go to the next slide, Audrey. As women, we're born with all the eggs we'll ever have. So women are born with about 2 million eggs at birth. And by the time a woman reaches her first menstrual period, we're already down to 300 to 400,000 eggs. I'll pause for a moment because if you haven't heard those numbers, it's astonishing. So we go from 2 million to about 300 to 400,000 just in that first decade or so of our lives. And then from there, regardless of whether you're on birth control, regardless or not if you actually had a menstrual period, we lose up to 1,000 eggs a month starting from our very first menstrual period. And so it's unfair. It's like, wait a minute. And so when people talk about biological clock or people talk about, aging, it really does matter to women. And unfortunately, this is information that we all kind of think we know something about. And so I really want this, if nothing else resonates, is to just really understand that time and age really do matter when it comes to a woman's fertility. All right, so what is it about age? Well, so some people are like, okay, I get it, age is important, but then the misconception is that we're perfect, 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 and then we turn 35 or some magical age, and then we jump off a cliff, and that's just not the truth. The reality is that we're declining really from birth, and so while there are some generalizations that we can take into perspective, so for example, women over 35 have higher risk of miscarriage. Women over 35 have a higher risk of having a child affected with a genetic abnormality, most commonly Down syndrome. And those are some commonalities, but the reality is that 1 out of 10 women under the age of 35 can have premature ovarian decline or premature ovarian failure, and they would never know. It's not something that's symptomatic. So you could still be getting your periods every month. You could be the healthiest version of yourself. You could exercise, eat well, be totally organic, and have a poor egg count, and you would never know. And so that's where I think it's really important to not just assume just because you're young that your fertility is great, and also not to assume because you're a certain age that you have no options. And so it's really important regardless of where you fall and regardless of whether you're ready to have a baby, maybe you were ready yesterday, or you're planning on having a child maybe in the next 6 to 12 months, or you're postponing this intentionally and thinking it's 5 to 10 years before you have children, to find out where you're at now so you can use it as a concrete baseline so that then you can make the appropriate choices for your future. So we just talked a little bit or quite a bit about egg count. The other matter that's really important for women to realize is that our egg quality also declines with age. And what do I mean by that? So we're born with all the eggs we'll ever have, and each one of our egg cells has 23 chromosomes. That's what makes up the DNA of our eggs. And our egg quality, meaning those 23 chromosomes that are make up of that egg, we were born with. So our eggs are always going to be as old as we are. And just like when you age and your hair texture changes, your skin changes, your body looks different, those are all a result of cells aging. Our egg cells also age, and as part of that aging, the 23 chromosomes deteriorate. And so that's where risks of Down syndrome increase and risk of miscarriage increase in women over 35. And so recognizing that egg quality is not something that we can clinically test, we just know that it's directly correlated to increasing in age. All right. So what's the reality? What's my take-home message? You're never too young or too old to learn more about fertility and what it means for you. So again, don't just assume because you're young, you're perfect. And don't assume because you're 38, 39, 40, 41, or even older that you don't have any options. It's really fundamentally important to not just guess and say, oh, well, my mom had, me when she was 43, or my aunt so-and-so had a baby when she was older, or I know nobody can have a baby after they're 40, just not to make those assumptions and to be as proactive as possible. And the earlier and the younger you are when you seek out learning more about your body, the more helpful it's going to be, because then the more options you will have. All right. So let's go down to some basics. All right, so I've spent my whole life trying not to get pregnant or trying not to get someone else pregnant. When am I most fertile? What does this all mean? So walk you through just some basics. So this red dot on this May 2020 calendar represents the first day of a woman's period. So it's the first day she starts bleeding. And regardless of how many days her period lasts, her most fertile window will be in this scenario, May 10th through the 14th. And so I hope, again, it's a little bit shocking, but we're only fertile for about 5 days a month, okay? And that's in a person who has a regular cycle, this would be the window where she's going to be fertile. Now, if you have an irregular cycle, you can't calculate it this exact precisely, because if someone has an irregular cycle, that means you're irregular, you're not ovulating on a schedule. But in a person who typically gets their period fairly regularly, let's say every 25 to 30 days, you can create a calendar and say, okay, these are my fertile days. So what does that mean? That means that if you were to have sex in that window of time between May 10th to 14th in this example, that would be your best chances of achieving a pregnancy. Now, some people use this to try to promote and help them get pregnant. And conversely, you can use this as these are the days you would avoid having unprotected sex to prevent pregnancy. But the take-home message is we're only fertile for 5 days a month. So even in a perfectly fertile person, our chances of achieving a pregnancy per month is only 25%. And when we think about it, it's only 25% chance of getting pregnant each month, even in a perfectly fertile person, and it's only really 72 hours a month that you are actually fertile, then it becomes, oh wow, it becomes kind of an eye-opener in that we're not actually as fertile as we all assume we are when we're 20. All right, how does ovulation work, right? So I like to use a tissue box analogy. Oh, this is so funny. Maybe it's presumptive. I ran out of tissues in my tissue box. This is so funny. Maybe it's a sign. All right, I can use Post-it notes as an example. So imagine that we are all born with a full set of eggs. So right ovary, left ovary, and within this box are all the eggs that you were born with. Just like you can't tell how many tissues are inside this box, I can't tell how many eggs are in your ovaries, right? But we can get an idea of how many eggs a woman has with a hormone called AMH. And this hormone can be tested anytime during a cycle, and we'll talk about it a little bit more in just a moment. But you're born with all the eggs you'll ever have. But each month, our body recruits a set of eggs. And so humor me, imagine this is a tissue. So each month, our body recruits a set of eggs from our ovaries. And this set of eggs are called follicles. They're actually visible on ultrasound. So you can do an ultrasound and see how many premature eggs or follicles a woman has recruited in a given month. And then what happens is your brain sends a signal to this batch of eggs to help one solitary egg, fully mature. And that one fully mature egg is the only egg that has the potential of becoming a baby. So we have all our eggs in our ovaries. Can't see how many there are, except with a hormone level. Each month, our body recruits a group of eggs to start growing and maturing. This we can count on ultrasound. And then our brain sends a signal to help one egg fully mature. That's ovulation. And this is the egg that would then meet sperm to create a pregnancy. At the end of the month, you didn't get pregnant. That one mature egg is lost. That entire batch of eggs that were recruited are lost. And then you go back to your tissue box, back to your ovaries to recruit a new set of eggs. And so that's how that occurs. And that fully mature egg is only there for a window, that ovulation window, where fertility is maximized during those 72 hours before it's lost. So what factors impact fertility? Our body doesn't just function in a silo. So it's not like your uterus and ovaries are functioning completely separately of the rest of your body. So it really becomes extremely imperative for women and men to recognize that our diet and lifestyle, family history, mental health are so imperative in being the best version of ourselves, right? So what is it important about diet and lifestyle? Not smoking cigarettes. Of all of the things that can impact fertility, we know for a fact that smoking cigarettes for both men and women can harm egg count and sperm count. So hopefully we're in 2020, nobody's smoking anymore. But if you are, really imperative to stop smoking, again, for full general health, preventing cancers, but also how it impacts fertility. Family history becomes important, but not the way that you think. For example, people often come and say, oh, okay, well, all the women in my family had kids when they were late. Not talking about that. But specifically, how old was your mom when she stopped getting her periods? And that would mean, how old was your mom when she went through natural menopause? If you are in a situation where your mom went through menopause because she had surgery, that doesn't count. But how old was she when she naturally went through menopause? Women whose mothers went through menopause under the age of 45, 45 is a magic number, have a higher risk of themselves going into early menopause. So that piece of information is really important. A lot of people don't know that piece of information. So if you have access to your mom next time you see her, or video conference with her, as we all do these days, ask her, what is that number? Because that becomes important. And then I can't stress the importance of mental health, especially right now in 2020. We've all gone through so many stressful times, how our jobs have been impacted, our finances have been impacted, our ability to just go to the gym and meet with friends have been impacted. And so reducing stress and mental health is so vitally important, not just for our fertility, but to get pregnant, to stay pregnant, and then to subsequently have a healthy pregnancy. So really important to not just isolate yourself and say, okay, I just need to know my egg count. As long as that's good, I'm fine. And recognize that all of these things really go hand in hand. And here at Kindbody, we have nutritionists that you can schedule appointments with directly through your portal. We also have mental health therapists that you can schedule virtual appointments with. So the nutritionists and the mental health experts are such easy ways that through Kindbody you can access this type of care without even leaving your couch. And right now, more than ever, obviously, virtual appointments become so important, and we have all of those ready at your fingertips. You can literally go to your computer and make an appointment today. All right, so at the end of the day, the key thing about fertility is that there's no magic formula. So while I really encourage everyone to be the best version of themselves and to be the healthiest version of themselves and to eat well and to exercise and to reduce stress, unfortunately, it's not just one thing. So it's not like you can say, oh, well, I'm vegan, I exercise, I meditate, I take really good care of myself, I haven't smoked a day of my life, that then I must be perfectly fertile. Unfortunately, it's not like that. I mean, I do encourage you to be as healthy as possible, but when it really comes down to fertility and egg count, it's something we control. There's things we can do to help make ourselves healthier, which then supports pregnancy, but it's not something that we can control. And so the key thing is to find out, where do I stand? What is my fertility today, so you can make the right choices for your future. All right, so what can you do? All right, well, we can start with a virtual consultation. If you prefer to do this in person, we also do have that option, but sometimes it's easier, especially right now with all of with the COVID pandemic, to start the process virtually. So you make an appointment. We have physicians on the West Coast as well as on the East Coast, and you'll be meeting with the doctor one-on-one. And we go over your medical history, your surgical history, what medications you take, your family history, and we really have a nice thorough discussion about your desires. You know, how many kids do you want to have? When do you want to have them? Have you already been trying? Maybe you've already done some fertility treatments. Where are you in your life's journey, so that we can then say, okay, here's your history, these are your plans, and then what are the next steps that make sense for you based on your desires? And how can we best help you understand your options? Do you need to get donor sperm because you're in a same-sex relationship? Or do you need donor sperm because you're planning on having a baby on your own? Do you actually need a surrogate because you're in a same-sex male relationship? So regardless of where you are in your journey, we can kind of help figure out the next step. So that virtual consultation becomes really important in helping us map out for you, what is it that you personally need to do based on your history in order to achieve that pregnancy, or in order to freeze your eggs to maximize your family planning options. And if you're here with us in person, we would obviously do all of this on the same day. So we would sit down and have a nice, robust discussion and counseling, and then we would immediately follow that with a blood work and ultrasound. If you do it virtually, then we would set up the virtual at a time that is convenient for you. But either way, after this robust discussion comes blood work and ultrasound. The ultrasound, so I mentioned we did the tissue wax analogy a few moments ago. The ultrasound is a vaginal ultrasound that allows us to do two things. One, we want to structurally look at the uterus and ovaries and make sure they're healthy. Do you have any masses? Do you have any fibroids? Do you have any cysts? And then secondly, we want to do a follicle count to see how many eggs are within the ovaries, how many eggs is your body recruiting each month, which then gives us a really good window into how fertile you are. And that'll also allow us to tell you how much time do you have. And then the second part is doing an AMH level. So the AMH allows us to see what is your ovarian reserve? How many eggs do you have left from that 2 million you were born with? Is your fertility still quite good? Is your fertility kind of middle of the road, or is your fertility low? And it's a combination of this ultrasound and blood test. Both are equally important, that then allows me to objectively tell you how fertile are you, what are your options for achieving a pregnancy, if that's something that you want now, or what are your options for achieving a pregnancy 10 years from now. It's really valuable because outside of if we don't do these two tests, then we're just assuming. We're just making assumptions. And I think that fertility is too important for us to just assume and cross our fingers and hope for the best. Let's find some objective data so we can make our decisions proactively and based on facts. What do we learn from the results? We can tell about egg quantity, and we can kind of get a rough idea of kind of what is your fertility window looking like. And one of the great parts about being with us at Kindbody is that from the moment the doctor has your results, you also have them. So it's not something where I, as the doctor, am the gatekeeper of your information. I want to be in a conversation with you about this. I want to be kind of your partner in the journey, as opposed to kind of saying, here's what you need to do, this is it, that's all, and really allowing you to have maximum information so that we can kind of be partners in this journey. So the AMH level, you'll get your results, you have a nice, really robust explanation of what that means, and the follicle count, which came from the ultrasound, will also give you a really nice kind of intuitive description, and you have that at your fingertips. You can share it with a friend, share it with your partner, share it with your family. So it tells us a lot about egg quantity. Remember, I was mentioning quality is really important, and that declines with age. Unfortunately, there's no test that can tell you how good your eggs are. We just have to know that egg quality is going to decline with age. And these are conversations we can have one-on-one to better understand, well, what does this mean for me based on my age and when I want to have kids? All right, so what are the options? Well, it really depends on what is it that you want, right? I always tell women, I can't tell you what it is that you need until you tell me what it is that you want, right? So it depends on your desires. If you you and a partner have already been trying to get pregnant and you have not achieved a pregnancy, then we need to talk about fertility treatments. And the fertility treatments aren't cookie cutter. There's a misconception that if you're having difficulty getting pregnant naturally, that must mean you automatically need IVF. And there's a lot of intermediary steps that may be an option for a couple before they reach IVF. So we can talk about intrauterine insemination. Sometimes maybe it's just making sure you understand when is the best time to have sex. So we can just monitor you and tell you when to have sex at home. So it could be as least invasive as that. Or maybe you have no desire to be pregnant anytime soon, but you want to maximize your chances as a couple to have children in the future. Then we can talk about embryo freezing. Or maybe you are a single woman who by choice doesn't want to have children right now, or maybe because you're focusing on your career or your finances or meeting the right person, or for whatever reason you're not quite ready to take on pregnancy at this time. We can talk about egg freezing as an option to prolong your fertility. And maybe sometimes it's for your first baby, maybe sometimes it's for your last baby. Maybe your fertility is perfect now, but you ideally would like to have 3 or 4 kids. So how can we maximize your opportunity to have that third and fourth kid? So really the key take-home message is once we know what your fertility is, once we know your baseline, we can then take your desires, your needs, your wants, and then say, okay, here's your options to help achieve that. All right, so what's egg freezing? Remember in my analogy, and this is so sad that I don't actually have tissues, but remember we talked about how we have all the eggs that we're ever born with in this tissue box, and each month our body recruits a group of eggs, and this group of eggs changes every month, but ever so slightly, so it'll vary by 1 or 2, right? So let's say this month you had 10 eggs that were recruited. These 10 eggs are premature, right? So the brain naturally sends a signal to this batch, as I mentioned to you before, to help one egg fully mature. Only a fully mature egg can become a baby, right? So what we do with egg freezing is we say, all right, if someone's not interested in pregnancy now, at the end of the month, this mature egg will be lost, and this entire batch of eggs will be lost forever. So what can we do to be proactive and opportunistic? We say, all right, this batch of eggs was recruited this month. We know only mature eggs can become babies. So why don't we help this entire batch all mature together so that we can extract them and save them for you to use in the future? That's all egg freezing is. We're not making new eggs. We're not making more eggs. We're not stealing from your stockpile or making it harder for you to conceive naturally. All we're doing is saying, we know this premature group of eggs can become mature with hormones, and once they're mature, we can extract them and save them. So it's really like saying, oh, let's just be opportunistic. Let's press pause, and so that then you could have 30-year-old eggs forever. And that's where the key comes in, is that by extracting the eggs out of the body, those eggs then stay as good as they were the day they were frozen. So if someone has 30-year-old eggs, those eggs will then remain 30, even when that woman is now 40 wanting to get pregnant. She can then get pregnant with her 30-year-old eggs, which will have better quality and will be a higher count than what she can naturally bring to the table 10 years later. So who should you consider freezing eggs? I've never thought about this. I've heard other people have done it. Well, what does this mean to me? And really, it's kind of having a heart-to-heart with yourself. And if you happen to have a partner, I would encourage you to do this exercise by yourself and then do it with your partner. See what your answers are. So the first question is really easy. How old are you? Don't lie. The second question is, how many kids are in your ideal family? And be really honest. Sometimes I sit with patients and they're like, you know what? I think that number is 0. That's fine. That's okay. Or that number ideally is 3. And so whatever that number is, just be honest. Like ideally, I would like to have however many kids it is. And sometimes it's a range. But be honest. Come up with a number. And then realistically, how old will you be when you have your first child? And again, be honest. Take into factor all the things that matter to you. It could be finances. It could be the right partner. It could be your career. It could be your travel needs or wants. It could be all of the above. But how old will you realistically be when you have your first child? And then maybe even a harder question, how old will you realistically be when you have your last child if you want more than one? And the big thing that I think people often forget about is we're all so focused on how old will I be when I have kid number 1 that we forget about our ideal family and our last kid. Is if you take into consideration that pregnancy is basically a year, it's 10 months, 40 weeks, and that the medical recommendation is to wait 1 year from the birth of a child to the start of the next pregnancy, at the bare minimum, your spacing is going to be 2 years. And all of a sudden, if you start thinking about it, it adds up. And we know our fertility declines with age. So this is a really important exercise. And if you fall where you're going to have one or all of your children after the age of 35, I would strongly advise you to at least consider egg freezing. All right. And so how does the egg freezing process actually work? So I've walked you guys through it, so we'll skip this slide and go directly to the next, and I'll give you a really nice graphic. So this we already talked about as well, so we can go to the next slide. So basically what we're doing, and the part that scares most women the most is, remember I mentioned to you we have a group of eggs and we're trying to help them mature. So that maturation occurs with injections. They're teeny tiny injections. There's actually on our YouTube channel that I'm sure Audrey will connect you guys to with really nice videos where you can actually see them. But what we do during about a 10-day process is we're giving you very small injections. They go right, you pinch the fat in your stomach, it goes right under the skin of the stomach, and we're giving injections for about 10 days to help that batch of eggs your body recruited that month mature. And so that's all they're doing, though. They're not making new eggs. They're not making more eggs. They're not making you into a PMS queen. It's actually very well tolerated. And then once we reach a point where the eggs are fully mature, and how do we know they're mature? We'll be monitoring you with ultrasound and blood work, is when eggs are extracted. Why is it important to use these injections? Because without the injections, the eggs will not mature. And we have to have mature eggs in order to fertilize them. And the entire process, from beginning to end, the maximum would take about 14 days. And so I know this graphic is a little bit small, but you see the stop sign. If a person is on birth control, that's when they would stop their birth control. If you're not on birth control, that's perfectly fine. We would just start with your natural period. But that's often a question, do I need to stop my birth control months in advance before doing egg freezing? The answer is no. In reality, you really just have to stop it about 5 days before your egg freezing cycle. If you have an IUD, you leave the IUD in place. You don't need to remove it regardless of the type of IUD you have. But basically starts about 5 days after birth control is stopped or after 2 days after a natural period. We're giving you injections for about 10 days, and then the retrieval would occur in the final 12th to 14th day of the process. So from beginning to end, it's 14 days, about 10 days of injections. So it's not as much of an investment of time as people often think. And this is the exact same process you would go through if you were doing in vitro fertilization. The only difference is someone who's interested in freezing eggs would stop at the egg retrieval and the eggs would be frozen and saved. And a person who's interested in achieving a pregnancy, on the same day that we retrieve the eggs out of her body, we would then introduce sperm, either from a donor or from a partner. And then the egg is fertilized with sperm to create an embryo. And then we can genetically test the embryo to see if it's normal. And then we would transfer the embryo back in the uterus a few weeks later to achieve a pregnancy. So the only difference between egg freezing and IVF is, when do you actually want to be pregnant? With egg freezing, you want to be pregnant in the future. With IVF, you wish to be pregnant now. All right, how does the retrieval work? So I just mentioned to you, you come in and we take the eggs out of your body. How does that work? The retrieval is a 10 to 15 minute procedure. It's done under anesthesia, so it's not considered a surgery. You are under anesthesia because we do need you to be perfectly still, but it's a sedation, like a twilight sleep, so no tube down your throat, not being intubated like major surgery. And this procedure takes only about 10 to 15 minutes. It's all done through the vagina with a very small needle that passes through the ultrasound machine so that we can actually observe what we're doing. And I know a needle ultrasound, whoa, but remember you're asleep for all of this, so you won't feel anything. And this is a process where we go right up to the ovary, pretend this is an ovary, and we're extracting through a very gentle suction those eggs that we matured over the previous 14 days. And what is the difference between egg and embryo freezing? I mentioned that previously. So the main thing to understand is that it really depends on the age of the egg. So the age of the woman at the time that she's wanting to freeze. Given the same age, so let's just, for the sake of argument, use a 30-year-old. A 30-year-old woman who freezes eggs or freezes embryos, the outcome is going to be the same. The major difference is that two things. Well, one, you need to have sperm. So you either need to be committed to that partner and say, I'm going to make embryos with this person, taking into consideration that sometimes even the best relationships end. So if we're going to be proactive and think about the future, we do need to think about that. So if you don't have a partner, you may prefer to just, in your mind are thinking you'd like to meet someone, then you would just want to stop at freezing eggs so that you have the option of fertilizing them with someone of your choice in the future. if you have a partner and you're committed to it and you've made your decision that you do want to freeze embryos, or you know that you will ultimately be using donor sperm anyway, whether it's now or in the future, then we can create embryos. So part of it is committing to the sperm. And then the other part is how much information do you want to know today? So if someone is young and quite fertile, then freezing eggs is good because we can say we need about 10 eggs for the improved chance of one baby. And if you have a very good fertility, you may get 20 eggs. That's an improved chance of two babies because it's a 10-to-1 ratio. And we can stop there. But if someone's older and their fertility is low, and we're only getting a few eggs out of their retrieval process, then in that case it might be beneficial to make embryos so we know exactly what we have. We have 3 genetically normal embryos, or we got 5 eggs and none of them are genetically normal. So it allows us to really pull the layers of the onion and know exactly what we're dealing with. But from a success rate, whether I fertilize an egg today or I fertilize that same egg in 10 years, their outcome is going to be exactly the same. It just depends on how much information do you want to know today about your eggs and their potential versus waiting to see what happens with them in the future. It's a complex topic. Hopefully that was just skimming the top. But the bottom line is that eggs and embryos have equal success depending on the woman's age. All right, what comes next? All right, so maybe you have eggs, maybe you made embryos, whichever it is, they're going to be stored in our facility at Kindbody until you're ready to use them or not. So my hope for any woman or couple who freezes eggs or embryos is I hope you never need them. I hope that you're able to you freeze eggs or embryos right now because you're being proactive and you end up being able to conceive naturally on your own. And this was just a backup plan that you didn't need, because then you could have a baby for all by yourself with sex for free if that's an option. But let's say you turn out and you ended up having your first child naturally and no problems, and now you're trying to have your second or third baby and you're having difficulty. Having those frozen eggs or embryos is going to dramatically improve your chances of having a successful pregnancy outcome compared to trying to get pregnant once your fertility has declined and once you're older. So what you do with those eggs or embryos ends up being, again, more options. You could end up never using them and you'll call us someday and just discard them. You could end up needing to use those eggs or embryos to have all your children, or you could end up having some of your children naturally and end up needing those eggs or embryos for your last child. So it's all about options, and these are all things that we can sit with you one-on-one and help you further explore on a case-by-case basis. Right. And then I talked to you guys about IVF. It's really exactly the same process. So if there's any specific questions, let me know, but we talked about this already. And then the next slide talks about what does it really mean to be infertile. So far I've talked to you about kind of the natural process, our fertile window. I've talked about egg freezing, talked about embryo freezing, we talked about what IVF is. But what does it truly mean to be infertile? So the definitions are that if you are under the age of 35 and you have been trying for 12 months, meaning you're having unprotected sex for 12 consecutive months and you have not achieved a pregnancy, by definition, you have a fertility problem. Or if you're over the age of 35 and you've been having unprotected sex for 6 months and you have not achieved a pregnancy, by definition, you have a fertility issue. The key thing to understand, though, is this is really common. 1 out of 8 couples experience infertility. That doesn't mean 1 out of 8 couples never have a child. It's just 1 out of 8 couples may need some assistance to achieve that pregnancy. And 1/3 of people who are having fertility issues, it's actually the male. So I spent all this time talking to you just about women and eggs and all this stuff, but it's realizing that if you do have a partner, just as vital as having yourself assessed is to do a semen analysis for your partner to find out what is his sperm count, what's his sperm looking like. And it's so easy and non-invasive for men to check their fertility. It's literally ejaculating into a cup and then having a a technician evaluate the sperm. So really encourage to not exclude your male partners if you have one in this journey and in this process of learning more about your bodies. And this is something we can do for you at Kindbody in our offices. So again, back at the end, kind of I started with options, I'll end with options. The bottom line is that to recognize that that the earlier you start your journey, the earlier you start asking questions and being proactive about this, the more options you will have. So maybe it's just helping you figure out the best time to have sex. Maybe you need intrauterine insemination for donor sperm or a same-sex couple. Maybe you need IVF because you have been having unprotected sex for over a year and have not achieved a pregnancy. Or you need donor egg, whether because your own fertility has declined or because you need an egg because you're a same-sex male couple, whatever the case may be. Or you need a carrier because you have a medical condition that prevents you from being able to actually carry a pregnancy, or you've had a hysterectomy, or you don't have a uterus. So these are all things that we can help you explore. And we recognize that all of these things can be extremely overwhelming, time-consuming, and difficult to navigate. And that's one of the things we really pride ourselves at Kindbody is we're going to do a lot of this work, or as much of this work for you as possible. We have all the right team members assembled to answer all of these questions thoroughly. All right, so what's your next step? Whether you are actively trying to get pregnant or you are actively trying not to get pregnant, regardless of where you are in your journey, or maybe you have no plans of having kids anytime soon, to the very least do your assessment and just learn more about your body, learn more about your partner's body, so that you can then have as many choices as possible. And that's the end of my part. I'm here to answer any questions. If you don't want to ask questions through this mechanism, I know everyone has their own privacy, please send us messages directly. The team knows how to link you with me. I'm always available and happy to help in any way I can. And thank you for having me. I hope this was informative.
Thank you so much, Dr. Sasan. I know I learned a lot. I've heard your talk before, but I always walk away with something new, so I really appreciate your time. Just to close this out, but we definitely will have time for questions. I know there was quite a few questions in the chat, and we even had some to the broader group, so we'll make sure we address those before we wrap up. But again, you have customized coverage specific to you. So any questions at all, you can always reach us at employeebenefits@kindbody.com. We can get you in touch with the right clinical team. We can get you in touch with the right care navigation team, but this can be your one-stop shop. You can email us at employeebenefits@kindbody.com. That's set up specifically for the employees of our employer partners and those who offer Kindbody as a benefits package. The next question that may come up, and apologize, this is blurry, I'll make sure you all have the link in the follow-up email, but is how can I enroll? And so all of you should have received something from your human resource or your benefits team with respect to Kindbody and the coverage provided to you, but we also have all of those on file and can always provide those to you whenever you need. The easiest way is just head over to our website. It's kindbody.com or kindbody.com/members to get started and set up an account. So what you're going to do is you're actually going to create a patient portal account, whether you're ready to book an appointment today, or maybe you just want to see what Kindbody has to offer, what appointments are available. All of you were provided a code from your company. And the reason we have a lot of different people joining today. And so all of the codes are specific to your company, which matches the coverage that you have provided to by Kindbody. So you're going to enter the code provided to you by your company. It's typically 1 or 2 words. You're going to create your Kindbody account using your work email address. Again, nothing specific to you, no clinical data, no patient information will be provided to you via email. It's really just setting up with your work email address so we can verify your coverage. We just want to ensure, as well as your company, as well as you do, that we match you to the right coverage and ensure that we're providing it to you in the right way. But again, any and all questions can always come to employeebenefits@kindbody.com. I really appreciate you all joining. And with the remaining 7 minutes or so, would love to open it up for questions. We have Dr. Sasan here as well as our Kindbody team, and we'd be happy to address it. So Dr. Sasan, I think there was one earlier in the chat.
We have
pull that up.
We got muted. Hang on one second. How did you get me?
There you go. Perfect. I was like, I can't talk. I saw one, and then Tracy, let me know if I'm missing any.
I do have a few private ones, and I'll share those with you. So if you want to start with that great one that was about on the pill, does that mean you lose less eggs? And can you still come in for an assessment if you're on the pill?
Absolutely. So unfortunately, the being on birth control of any kind, whether it's the pill, the IUD, the Depo-Provera, the implant, unfortunately does not reduce our loss of eggs. I wish it did. If that was the case, we would just all go on birth control and be fertile forever. But unfortunately, even that loss of up to 1,000 eggs a month occurs regardless of whether a person is on birth control or not. That's one. And two, we can do the assessment on birth control, on an IUD, and a person who hasn't had a period in years, and a person who gets their period twice a month. It doesn't matter. So you can do the assessment on birth control, off birth control, and regardless of where you are in your cycle.
And then a private question that I received, which I think is important to address, is if someone was trying to have their a baby on their own, and what would the process be? So they would go through the process to have an egg retrieval, and then I let them know that we coordinate all aspects of it. But can you kind of approach it from the medical side and talk about that a little bit?
Sure. So if someone's wanting to have a baby on their own, we still have to start off with assessing your fertility, because you may be very fertile, and all we may need to do is just get the sperm through a donor, or if you have someone in mind. But we may just need to get sperm and help the sperm reach your uterus, and that would just be as simple as an intrauterine insemination. In that world, you don't actually have a fertility issue. We just need to introduce sperm. Now, if someone's fertility is low and they need in vitro fertilization or IVF to achieve a pregnancy, then we would need to trigger your ovaries to create eggs and retrieve the eggs. So the first step is doing that fertility assessment to see where you're at and what do you need personally to achieve a pregnancy, and then let us tailor it. We're never going to just go straight to IVF if you don't need it. We always want to do the right make the right treatment plan that's the least invasive for you.
And those are actually all the questions that I had, but like Audrey said, we will share this talk and let everybody know. And if you do have any questions, Audrey listed the email. You can always reach out, and we're here 100% to support with whatever that we can.
Right. And then just one last thing, especially since this is a benefit through your employer, I do want you to know that you can, even if you're not at all interested in the fertility aspect of it, which I hope I have demonstrated that it is important to be, but we do the full service of GYN care too. So I know a lot of us have been putting off our regular health because of the COVID pandemic. So come and see us, and you can just schedule your regular checkup, even if you're not quite ready to dive in deeper.
Dr. Sasan, one question came in just for the broader group. If it's a couple and the female and the male both want to get a fertility assessment done, can they do that at Kindbody, or how would that work?
Absolutely, yeah, and we encourage that. So if you are a couple, you can come together if your schedule allows, and we would do schedule a semen analysis for the man and do the fertility assessment for the woman. So that's definitely something we can do. Or if your schedules don't allow for you to both come at the same day, then we can schedule one on one day, one on the other. But for sure, we do the full evaluation of both couples, including things like genetic carrier screening and everything for both men and women.
Well, great. Well, thank you so much, Dr. Sasan, and thank you so much to everyone that joined today. We will send you a follow-up email to make sure that you have the link so that you can create an account, and also just provide the right contact information if you have any other questions after today's call. but we're here and we are so happy that you joined us today, and we look forward to getting to meet you all and to help on any family building, fertility, women's health, men's health needs that you may have. So thank you again for joining, and have a good rest of your week.
Bye-bye, everyone. Have a good 4th.